13%, and state and national are 9 and 11. So we definitely have an issue here. So I always start my presentations by saying, how many of you have heard of the American Diabetes Association? Everybody. How about the Juvenile Diabetes Research Foundation?
JDRF.
JDRF. That's not us. And so many people think that we're an affiliate of one or the other, or both, oftentimes because we do camps for kids. The agency started in 1963 with the sole purpose of doing camps for children with type 1 diabetes, because at that time there were no camps for children with type 1 diabetes. All children with any kind of disability went to what was called the Crippled Children's Camp. So the doctor and the health commissioner at that time set up a camp for kids with type 1. And as the needs grew in the community, the agency morphed into an independent local diabetes association, which means all of our monies stay right here locally. We don't send them off to a corporate office such as the ADA or the JDRF. They stay here. And that's really misinformation. And there's nothing wrong with those organizations. The ADA sets standards of care for medical professionals, and the JDRF is working on research for a cure. They do not have local offices, but because we are a diabetes association and we're very small, we have a staff of 2.5, and one of which is me. People assume, well, you must be an affiliate of one or the other. And one of the reasons we partnered with Sinclair, because they have a digital marketing program, and I'm really trying to get the word out about who we are, because even though we've been in the community for 54 years, people every day say, I had no idea you guys were here. I said, we have been here for 50 years. But people just assume we're affiliated with one of the nationals. In addition to camp for kids with type 1, back in 2010, I wrote a grant and started a camp for children with type 2. Now, it used to be unheard of for a child to have type 2 diabetes. As a matter of fact, type 2 diabetes used to be referred to as adult onset diabetes. And as children's lifestyles and diets changed, we saw an increase in obesity. We see an increase in type 2 diabetes because of psychotropic drugs. Many kids are on like an antidepressant, which causes obesity. And these kids, few of them would find their way to my type 1 camp, and they just didn't connect. The type 1 kids are all on insulin because their bodies stopped making insulin. Type 2 kids are usually on oral meds. Type 1 kids are counting carbs. Type 2 kids are counting fat and calories. So I said, these kids need their own camp. They need to talk to each other about the things they're dealing with. They're being bullied, oftentimes being pulled out of school because of that bullying. So they need that social network. So now we have two camps for two types of diabetes, type 1 and type 2. And the camp for the type 2 is also for children at risk for type 2. So it could be pre-diabetes or insulin resistance. In our second year of camp, we had 24 kids. And in the course of 1 week's time, they lost 103 pounds collectively. And people say, oh my goodness, did you starve them? No, they had 3 meals and 2 snacks every day, but they were healthy meals. Some of these kids live in what's considered a food desert. They don't have access to fresh fruits and vegetables, and some of them had never tried a strawberry. So we introduced them to the importance of fresh fruits and vegetables, the importance of exercise, and they had a great week at camp. When they come, they talk to each other, they bond, they have a separate activity level that's going on, separate from our type 1 kids. So we still do camps. This will be our 54th year of camp. The other thing we do at Diabetes Dayton is we help people get their testing supplies. If you know anyone with diabetes, you know that it's important to test your blood sugar. And those little strips that go in those blood sugar machines are extremely expensive, about $1 or more a strip. So if you are low income or you don't have good insurance, what happens is people stop testing. And then we get the complications and things that can lead to diabetic retinopathy or losing your amputation, losing a toe and having amputation. So my philosophy was we want to make sure everybody's testing. So we have free supplies for people without insurance. If people have insurance, but their copay is still high, they can come and get 50 strips for $10 at the Diabetes Association of Dayton, or what we rebranded as Diabetes Dayton. One of the reasons we rebranded, our official name is the Diabetes Association of the Dayton Area, which is a mouthful, and we realized that did sound a lot like the American Diabetes Association. So in 2010, same year we started our type 2 camp, we became Diabetes Dayton. But we don't really have boundaries. We will serve as far as people ask for any kind of assistance. In addition to our camps and our supply assistance program, We do diabetes self-management education classes where if you get diagnosed with diabetes, you can come and get free diabetes self-management education classes. Now, I thought it was important that we get accredited. All of the hospital-based programs are accredited because they bill. And we had this program going on, and it was every bit as good as the hospital programs, but it wasn't accredited, and it was free. And so there's this perception, well, if it's free, it's probably not very good. So we sought and gained accreditation, and we offer free diabetes self-management accreditation. If you were to take it through the hospital, they would bill your insurance about $650. And so the other thing is, most insurance will pay for one diabetes education program, and a lot of times when you get diagnosed with this disease, it's overwhelming, the information that you need to take in. So many times people will go to an education class, and about 6 months, maybe even a year later, they'll say, you know what, I need to go back and hear this again, or I need to understand more about carb counting. So they can come to our class, and we always encourage them bringing a support person, because that support person is going to be your cheerleader, making sure you're testing, making sure you're watching your carbs and your diet and your meals. In addition to our diabetes self-management classes, we also do the Centers for Disease Control's diabetes prevention program. So you could have what's called pre-diabetes. 86 million people in this country have pre-diabetes, which means their blood sugar levels are high, not quite high to be classified as having diabetes, but they're on their way. So this is an evidence-based program from CDC that helps people avoid getting full-blown diabetes. We've also started a new program called Healthy Me, and it's kind of like the diabetes prevention program, but anybody can take it, whether you have diabetes, pre-diabetes, or you just want to learn about keeping healthy. And we have a certified lifestyle coach who's also a diabetes educator, and I really scored with Erin. I love her to death. She's a trained culinary chef. So we do healthy cooking classes, and she will take a recipe. She did an entire Thanksgiving meal, and she remade it. And I think sometimes people hear the word healthy and cooking, and they think, oh, what does it taste like? Well, let me tell you, everything she creates is delicious, because she makes sure it's not just healthy, but it tastes good as well. So we have lots of different things going on in our little office. We have a classroom with a kitchen, and we do classes on Saturdays. We do them through the week. We go out and do presentations. We have in November, which is Diabetes Awareness Month, we have a large diabetes expo down at Sinclair College, where we have vendors in the main Great Hall, and then we have speakers down in Charity Early, and then we have screenings. Matter of fact, usually the Federation of the Blind is there. Wanda Sloan has come to represent you guys, and has always done a fabulous job. And it's so important, and it's, I like to tell people, it's not a health fair, it's a diabetes education expo. So you're not going to see, 6 bike helmets and everything there. It is everything about managing or preventing diabetes, so that you can learn how to stay on top of this. What's unfortunate about diabetes is it's kind of become a dirty word. Nobody wants to talk about this disease, because it's been associated only with being overweight and sedentary. And so people think, oh, well, it's your own fault. You got this disease. You're overweight, you didn't exercise. So now we have what's going on, people not even talking about this disease, or not even feeling comfortable telling someone they have type 2 diabetes, because there's such a negative stigma around this disease. In type 1 diabetes, your pancreas stops making insulin. It's an autoimmune disorder, so you have to go on insulin. With type 2, it can be lifestyle. It can be, related to being overweight and inactivity, but it could also be medications, it could be an illness, it could be, sometimes they've seen viruses. There's all kinds of different reasons. But no matter the reason, it is still a very serious disease with very serious complications. It's the 7th leading cause of death, and in African Americans in Dayton, Ohio, it's males. It's the 3rd leading cause of death. So, we need to be looking at this disease much more seriously and talking about it much more seriously. Many people make jokes about diabetes, unfortunately, but we need to be talking about this disease and why we need to take prevention steps and the appropriate management steps, so you don't get those complications, the heart disease, the foot, amputations, the vision loss, all those things that kind of go hand in hand, because it is, the direct relationship with heart disease is very, very strong. Oftentimes someone will go into the hospital and they have a heart attack, And when they get the blood work back, lo and behold, they had diabetes and didn't even realize it. Because those symptoms creep up on you slowly, and you kind of ignore them, and you think, oh, this is, part of getting older. My vision's blurry, I'm getting up to go to the bathroom in the middle of the night, my sores on my skin aren't healing, or my skin is dry and itchy. All those things together can oftentimes mean diabetes. But unless you see your physician regularly and get checked, it can go unnoticed until you get a serious complication. So that's why we really, really encourage making sure you get your annual checkups. If you are having any of those symptoms that I just talked about, make sure you get your blood sugar checked, which we could do at Diabetes Dayton, or you could do it at your doctor's office. How am I doing? I feel like I'm rushing through.
No. Actually, you're doing great.
I brought handouts, and I never force my handouts on anyone, but I always want them to be available in case anybody wants to take them. And if you don't, it doesn't offend me or hurt my feelings in one bit, because handouts are expensive, and I'd rather tell people, take them if you want them. If you don't take them. But I have, one of the things we do at our annual Diabetes Expo every year is we update what's called the Diabetes Resource Guide. And this is all things in the Greater Dayton area related to diabetes. So Federation of the Blind, vision programs are in here, foot doctors, endocrinologists, which are the doctors that specialize in diabetes. We also have the national programs that people might want to look up if they're on, say, Novolog. Novo Nordisk is the pharmaceutical company that makes it, and they have a patient assistance program, so they could find that in here. So we make a diabetes resource guide available with all the updated information every November, which is Diabetes Awareness Month. The other thing I brought along is information on our camps. That'll be coming up in July. Yeah, you had a question?
Where's your camps located?
Great question. Our camp is at a YMCA facility, outdoor rec center up in Bell Fountain, Ohio. It's called Camp Wilson.
My son went to a diabetes camp all the way up until he couldn't go no more.
Oh, I wonder if he came to
He went down to Hamilton somewhere.
We used to be there at Camp
okay.
Campbell Guard. We used to be down at Camp Campbell Guard, and for a couple of reasons, that the facility wasn't meeting our needs, and the American Diabetes Association came in and put their camp a week after ours, and everybody was really getting confused, and I thought it was important that we have our own facility. So now we're up in Bell Fountain. And it's wonderful because there's a lake there.
He volunteered one year.
Yeah.
He got older.
What's the last name?
Harmon, AJ.
Oh, okay, yeah. So I've been here a long time, so I bet I remember having him as a counselor. That's the beautiful thing about our camps, is that once the kids go through as a camper, they come back as young adults to be the counselors, and they make wonderful counselors because they have been through this and they understand it, and the kids really look up to them as counselors. So it's at Camp Wilson. They're run the same week, but they have separate programs, the Type 1 and the Type 2. I also have information on our classes, the healthy meat classes and the healthy cooking classes that Chef Erin is doing. Every month she has a different topic, and in March she's doing delicious healthy Easter feast. So she usually takes, again, traditional meals and remakes them, but does so in a very healthy way. And so when you come to our cooking class, you not only get to watch Erin demonstrating how she does the remade recipe, you get to have an entire meal, and you'll have all the recipes so that you can take home and replicate them at home. So I have all that information, and now I guess I need to ask if there's any questions.
I'd like to add, my first wife, she passed away from a heart attack because she was diabetic, and she went through everything. She even lost her vision. She had kidney transplant. She was on dialysis, and then she went on peritoneal dialysis, and she was legally blind, and she would catch the bus every Wednesday to the Joslin Clinic in Boston from Andover, and she would teach diabetics there at the Joslin how to cook with a wok.
Oh, wow.
She was awesome. I mean, here she is, legally blind, catching a bus every week.
And teaching cooking.
She had her, teaching cooking. Yeah. And at 41, she had a heart attack after surgery, and she died.
Oh my goodness,
She was
I'm
wonderful.
so sorry. Yeah, it's an awful disease.
Yeah.
And I tell people it's not awful just because it does kill you, but first it debilitates you. And you know, it takes your kidneys and your vision and your limbs, and
Right.
you know, it's the quality of life is awful, and so the complications can be so severe with this disease. Management is everything, and even with the best management, sometimes you